Dr. Nathan Kowalski here at Restoration Chiropractic. This is a video of me adjusting one of my patients, Don. So Don originally came in with overall soreness, knee pain, feet pain, low back pain, and he attributed all of this to a high demand job where he overworked a lot and he works in a high stress environment. Since starting care at Restoration Chiropractic, Don has been feeling really good. So if this story is similar to yours, where maybe you work really hard, you have high stress at your job, follow in Don's footsteps and come make an appointment with me at Restoration Chiropractic. I hope you enjoy this video. Thank you. Fine, this is the first step you're just feeling. It's called static palpation. So you're looking for any swelling along this whole spine. You can actually feel some swelling and just tightness right up in here. I don't know if you can see that, but that's starting to get red when I move my fingers there compared to the rest of his spine. There's probably something going on in that area. This is a nervoscope. This measures heat on the back. What I'm looking for is any nerve irritation or nerve pressure. This is T4, also got a scope break here. He also is really red when I was originally feeling his back, right in this area here. And we're gonna watch Don walk. We're gonna see what his walk looks like before the adjustment and then after the adjustment. So this is L3, this is a knee chest table. This is gonna help open that disc up and get a really good, nice adjustment. And this is L3. So what I'm gonna do is lift that bone up to bring some space in the disc. These are Don's x-rays, full spine x-rays. This helps me see how to adjust the bone. In Don's case, we're at L3 right here. L3. We also got to be at T4 here on Don today. So we're at L3, T4. That's what we're going to adjust. T4 goes to the gallbladder, stomach, lungs, heart. Chest drop, belly drop.